crowd trickles in. Okay, so I'm Tan Mo Pin. I'm the organizing co-chair of this very auspicious 20th, no, not the 20th anniversary, but the 10th Malaysian Conference of Healthy Aging. Yeah, and I'm also a professor of geriatric medicine at the University of Malaya, and therefore it is actually my greatest pleasure to introduce my former dean, but still my boss, because she's now the head of Health, which actually includes the Faculty of Medicine, University of Malaya Specialist Centre, as well as University Malaya Medical Centre. But she actually really needs no introduction. She's now Professor of Infectious Diseases, Faculty of Medicine, University of Malaya, and also Director of CHERIA, which heads AIDS research in Malaysia, as well as the President of International AIDS Society. The number of awards she's received for the amazing work that she has done, not just for HIV, for women academics, as well as everything else with regards to medical education and also she's also a great beacon holder for medical practice. She's someone that Malaysians should really be proud of. So without further ado, introduce to you Professor Adiba Kamaruzaman. Over to you, Prof. Adiba.
Some thoughts on the impact of COVID-19 on the elderly. It's kind of hard to believe in a way that we've lived through this nightmare, this pandemic for the last 2 years. To me, it is still as clear as day when we were kind of following these reports of unusual viral pneumonia towards the end of 2019. Only to have it announced as a pandemic in March of 2020. I think it's fair to say that no one has in this world has not been touched by this pandemic one way or another. Many have lost their lives, as you know. It has surpassed the 5 million 6 million total number of deaths, but the estimated real death toll is probably at least 3 times higher than that. So it's estimated that 18 million people have died as a result of COVID-19, and many millions more have been affected, either infected or affected by the disease. Very early on in the pandemic, it became very clear that unfortunately elderly people were at the negative receiving end of this pandemic, as the clinical picture became clearer and clearer coming out of China, and as large cohorts were being analyzed, it became clear that the morbidity and mortality were exponentially higher in people aged 65 and above. Over the last 2 years, as a result of putting together global data, the impact of COVID-19 on the elderly is actually many times more worse than was expected or than what we understood in the early parts of the pandemic. And here, this was a recent summary put together, actually not in a scientific journal, but in one of the leading newspapers or articles in a magazine called The Atlantic. And it actually shocked me to see these numbers that compared with someone in their 20s, a person who's 65 years old has at least 65 times, is at least 65 times more likely to die of COVID. If they're 75, 140 times, and if they're more than 85, 340 times more likely to die. So And there are many, many reasons for this, which I will go into now. So first of all, obviously, at the clinical level, at the pathophysiological level, the understanding of why older people have a worse outcome, it boils down to the immune system, both what we know as the, as we age, the weakening of the immune system to be able to overcome infections. And this we know it's not just with COVID-19, obviously, with all infections, our immune system becomes weaker as we age to withstand the onslaught of pathogens, organisms, whether it's bacteria or viruses. However, another unique aspect of COVID-19 and the elderly is also, and another reason why it has resulted in increased death is because although the immune system is weakened, but on the other hand, it overreacts to the infection in a pathological problem called the cytokine storm. In a sense, we know that aging leads to chronic inflammation, which is also seen in conditions like diabetes and obesity. And when you have a disease like an infection like SARS-CoV-2 infection that triggers the immune system is not able to break, if you like, but goes on overdrive and results in not just the ARDS that's seen in severe COVID-19, but also in some of the other pathological changes, including thromboembolisms, etc. So the cytokine storm is particularly, we saw a lot of that during the Delta surge. It's one of the main reasons why elderly people, obese people, and people with diabetes, individuals with diabetes, have a worse outcome. And of course, as individuals age, they also have these comorbidities, whether it's diabetes or obesity or end-stage renal failure. All this together leads to this horrific outcome that we've seen in the elderly, both here in Malaysia and globally, as numbers I just shared with you showed. So quite apart from the natural issues of immune system, both a weakened immune system, but ironically, on the other hand, you've got one that it goes into overdrive. You also have all these other comorbidities that result in poorer outcome in the elderly. So I've mentioned comorbid conditions, polypharmacy, immobilization, muscular deconditioning, fatigue, dyspnea. All this leads to poorer outcome. The second is, of course, the systematic or structural problems seen in the elderly. And again, as I was saying, nursing homes have been a particular problem, both here in Malaysia as well as globally. And the reasons for that are many. First of all, compared to standard hospitals, the ratio of health personnel and residents generally limited. The staff may not be as well aware of infection control, and the increased vigilance and the increased need for really strict infection control. And then, of course, with the sort of atypical presentation of the elderly with any disease, any infections, in particular with COVID-19, that diagnoses may not be made early of the infection in nursing homes. So this is a recently reported in the US that over 200 residents and staff in long-term care facilities have died from COVID-19. And I don't know what the figures are in Malaysia, unfortunately, but if any of you are following the news coming out of Hong Kong, they're also literally battling a massive COVID-19 outbreak in Hong Kong, where elderly care homes have been in the eye of the deadly COVID-19 storm in Hong Kong. They've had a problem with vaccinating the elderly there, and coupled with an earlier zero COVID policy tolerance, where natural infections have been on the low side. Hong Kong and China, to some extent, unlike other parts of Asia, is now seeing a big surge and increase in deaths over there. So, so first of all, you've got the, sort of a pathophysiology reason for the elderly being more at risk of severe disease, and then you've got a sort of environmental or systems reason in terms of the nursing home that leads to a large number of deaths as a result of COVID-19. And then we have other conditions, both physical as well as environmental, as well as lifestyle reasons for why COVID-19 has impacted and affected the elderly much, much more than those who are younger. And here are some of the reasons that include, increased falls, isolation, and depression. And we had some harrowing examples at PPUM where, literally the elderly were dying alone because of the quarantine, and, relatives were not able to come and, be with them through the last moments. And that was really very difficult, not just for the dying person, but also for the families and to a large extent, the staff as had a tough time sort of coping, I think, with this as a result of infection. The other ways in which COVID-19 has been tough on the elderly is, of course, other things like sleep problems and the I guess the incessant messaging of the pandemic has led to coronaphobia. I personally know of several people who've literally not left their house for 2 years as a result of fear of getting the pandemic. And how do you balance that? How do you balance protecting the elderly versus encouraging them to kind of not isolate themselves so much as a result of coronaphobia? And finally, as we know, the whole world moved towards digital in an even faster rate to cope with the pandemic, including in telehealth, telemedicine applications. And this obviously led to a digital divide with the elderly, who may not be so familiar and so savvy using smartphones and telehealth applications. Yet another factor that leads to isolation, that leads to reduced access to healthcare. And then on the other side, you can see a decrease then leads to decreased physical condition, life quality, decreased ability to combat chronic and acute pain, decreased physical activity level, all of this combined leads to poorer outcome as seen in the elderly. So this is a summary of some of the factors that led to poor psychological health and well-being in the elderly as a result of COVID-19. However, some studies have shown that having a strong religious faith, continuing with exercise, continuing with self-care, and spending time with nature are some of the positive factors that can contribute to better psychological health and well-being in the elderly as they cope with COVID-19. So just in the remaining few moments, we know that, in the first year and a half, the healthcare system was overwhelmed. We literally had very few tools to combat the pandemic, aside from admitting patients, and once they deteriorate, we did have medications, including steroids and some immunomodulators. But until what can I think can only be termed as a modern miracle, the vaccines came in December 2021, sorry, I've lost track of the year, December 2020, and early 2021, when Malaysia went head on with the vaccination program, things were looking pretty grim. But as the vaccination program took place, and although we suffered very now with the Omicron onslaught, although the COVID-19 vaccine, because we know that now studies, not just all over the world, but also here in Malaysia, that unvaccinated people face significantly higher risk of illness, 4 times more likely to become infected, and many times more likely to require hospitalization or death unless they were fully vaccinated and boosted. Many studies around the world have shown of the effectiveness of these COVID-19 vaccines in preventing hospitalization, particularly in the elderly. Here's just one example from the US. A very large database looking at how it has prevented hospitalization, at least in between February and April. Let me read here, among adults aged 65 to 74, effectiveness of full vaccination for preventing hospitalization was 96% for the mRNA Pfizer-BioNTech, 96% for Moderna, which we don't use in Malaysia, 84% for Janssen, which we also don't use amongst adults aged more than 75. So when you think about those huge numbers that I began with, in terms of the risk in the elderly, you can see how the vaccination has been truly, in terms of the game changer, in terms of turning around this horrific pandemic in the last 2 years. And so, of course, we must do all we can to make sure that all our elderly are not only vaccinated but also boosted. Now, is there a difference between the two vaccines that we use in Malaysia, i.e. Pfizer and Sinovac? Yes, there's been some use of the AstraZeneca, but much lower percentage. The concern is, yes, the Sinovac vaccine is a little less effective compared to the Pfizer vaccine. And here's the study that we ourselves did, my colleagues and I, using the KKM database. And it shows that the age-adjusted mortality rate is increase in people who receive the Sinovac vaccine. And I could spend hours talking about this, but basically, it's a 3-dose vaccine, and the 4th dose is a booster. whereas the mRNA vaccine is a 2-dose vaccine. So the world over, the mRNA vaccine has been shown to be more effective than the Sinovac. So for those of you who've just had 2 doses of Sinovac, I really, really urge you to get a 3rd dose if you haven't already, because in several studies, it's been shown that to be effective, it really needs 3 doses for Sinovac, particularly in the elderly. Now, unfortunately, I think the booster rollout has been a bit slower compared to the primary vaccination program. There's been a lot of misinformation and disinformation about vaccine safety. First of all, there was mistrust with the mRNA vaccine and Pfizer in general. Rumors going around or concerns about it being a new vaccine, untested, shortcuts were taken, all of which are untrue. And this is the most scrutinized vaccine program ever in the world. The EU, the UK, US CDC, and the Australians, and the MPRA in Malaysia, are following up on adverse events, and really suffice to say that, yes, of course, there have been some major adverse events, particularly in younger people with the thromboembolic disease seen in the AstraZeneca and to some extent, and the J&J, and to some extent the mRNA vaccine. But overall, the vaccines have been safe. So this is just one example. Sorry, this is about efficacy again. So data real-world use of COVID-19 vaccine provides reassurance about their safety in older people. Extensive vaccine experience has found no safety concerns in older people. So in other words, elderly people have no more risk of side effects than younger people. In actual fact, because of the slightly weakened immune response, the elderly tend to present with lesser side effects compared to young people, in both mild to moderate side effects as well as severe side effects. So really gives a lot of reassurance that the elderly should receive, of course, the primary vaccine program, the first 2 doses, but importantly, the 3rd dose, as well, as we now understand that the vaccine protection wanes with time. So I've borrowed these slides from Prof. Noma Manso, colleague from moving away from sort of the clinical and public health aspects of COVID, and to look at the impact of COVID-19 on the well-being of older persons in Malaysia. They've done some nice work doing phone surveys in people aged 60 and above, in 2 different complementary studies looking at impact of COVID-19. So in terms of impact on household income, there has been sort of not a huge impact, as here we can see in households reported enough food supply. These are households with older persons aged 16 and above. In terms of access to healthcare, it also appeared that it appears that 42% of older people, which is a real concern, but who may not be able to access healthcare either in a conventional way, physically, or using telemedicine. It's comforting to know that, at least in this survey, that there was not an increase in negative behaviors within household with older persons, including physically aggressive behavior, rising tension, psychological distress, or depression. It'd be interesting to expand this to a much larger sample size, as well as geographically. I think what we have here in Malaysia is still reasonable extended family structure, and it would appear that those with strong family relationships provided a better level of comfort that older persons are being taken care of. Majority went to government hospitals, although this ensured in terms of lesser financial burden on the individual and their families. However, that meant that it increased the burden of to government facilities and healthcare. So moving forward, I think the lessons learned from this pandemic are many, but in short, I think it really amplified existing inequalities, of course, but also amplified the strain that is already existing from an aging population that we have in Malaysia, that the elderly are disproportionately vulnerable, and our health system, we must surely learn from these last 2 years, and that we must adapt and prepare for greater care, so that the next time a pandemic comes, and unfortunately all the experts in the world are predicting that there will not be another pandemic, but when another pandemic is going to occur. And so it will be a tragedy, I think, if we don't learn from this pandemic in terms of preparing for greater care and needs, particularly as our population age, and really learn from the disasters that we've had in the last 2 years of COVID, specifically towards the elderly and the increased deaths that were seen. The importance of preventive rather than just investing in acute care. We must do more to promote healthy behaviors in the elderly, and I guess this conference, I've heard snippets of it. Some of the major studies that have shown the examples of healthy behaviors in the elderly to ensure healthy aging into the next decade as we all age. So from simple things like increasing physical activities like walking and being with nature, being with friends, have all been shown to induce healthy behaviors and better outcome in the elderly. We need to do better to improve use and access to primary care, but more importantly, as a health system, should we look at pivoting healthcare for the elderly at home rather than making them come to acute care hospitals like the UMMC? Should we be restructuring the healthcare system to improve care at home within the primary care setting? And which means that we need to engage better and train more allied healthcare, home nursing services, physiotherapists, occupational therapy, to provide that care at home, so that the elderly, whether suffering from an illness or not, can be managed better at home. And I think once again, COVID-19 highlighted all of this, that policymakers are re-examining and looking at the lessons